Good morning, medical students. Today, we will be diving deep into the fascinating world of neurology and specifically focus on cerebrovascular diseases. These are conditions that involve the blood vessels in the brain and can lead to a variety of neurological symptoms. Understanding the intricacies of cerebrovascular diseases is crucial for any aspiring neurologist, as these conditions contribute significantly to cognitive impairment and other neurological deficits. Now, let's start our journey into the realm of cerebrovascular diseases, beginning with our first topic. Small vessel disease, SVD, refers to the pathological changes that occur within the small blood vessels of the brain. These vessels, including arterioles and capillaries, play a crucial role in supplying oxygen and nutrients to the brain tissue. SVD is commonly associated with risk factors such as hypertension, diabetes, and aging. The pathological hallmarks of SVD include the thickening and stiffening of vessel walls, accumulation of fibrinoid material, and the formation of microinfarcts. These changes can result in ischemia, reduced cerebral blood flow, and subsequent neuronal damage. Clinically, SVD often manifests as lacunar infarcts and subcortical vascular cognitive impairment. Strategic infarcts are ischemic strokes that occur in specific brain regions, leading to characteristic clinical syndromes. These infarcts typically result from occlusion or stenosis of large cortical or subcortical arteries. The affected brain regions are strategically positioned to show well-defined neurological deficits, often reflecting the functions associated with those areas. For example, infarcts in the middle cerebral artery territory can cause contralateral hemiparesis and sensory loss, while infarcts in the posterior cerebral artery territory may result in visual field deficits. The identification and understanding of strategic infarcts are essential for localizing lesions and predicting the associated clinical symptoms. White matter hyperintensities, WMHs, are radiological findings commonly observed on magnetic resonance imaging, MRI, scans of the brain. These hyperintensities represent areas of increased water content and decreased myelin density within the white matter. WMHs are often associated with chronic cerebral ischemia due to small vessel disease. The clinical significance of WMHs lies in their association with various cognitive and neurological impairments, including gait disturbances, depression, and cognitive decline. Research suggests that the location, extent, and progression of WMHs are crucial indicators of age-related brain changes and may serve as a prognostic marker for cognitive decline and vascular dementia. Microbleeds refer to tiny hemorrhagic lesions observed on neuroimaging studies, particularly gradient echo sequences on MRI. These lesions are typically less than 5 mm in diameter and are associated with extravasation of blood products from fragile small vessels. Microbleeds are often seen in patients with chronic hypertension, cerebral amyloid angiopathy, and other underlying vascular pathologies. The presence of microbleeds has been correlated with an increased risk of future intracerebral hemorrhage, cognitive decline, and dementia. The exact mechanisms by which microbleeds contribute to these adverse outcomes are still being investigated, but it is believed that they result in chronic inflammation and neurodegeneration. Multi-infarct dementia, also known as vascular dementia, is a type of dementia caused by multiple, small infarcts or chronic ischemia in different brain regions. This heterogeneous condition can result from various underlying vascular pathologies such as large artery atherosclerosis, small vessel disease, or embolic events. The clinical presentation of multi-infarct dementia can vary depending on the location and extent of the infarcts. Common symptoms include cognitive deficits, memory impairment, executive dysfunction, and focal neurological signs. Early recognition and appropriate management of vascular risk factors are crucial in preventing or delaying the progression of multi-infarct dementia. Hemorrhagic dementia refers to the cognitive impairment and neurological deficits resulting from cerebral hemorrhages. These hemorrhages can occur due to ruptured aneurysms, arteriovenous malformations, or hypertensive bleeds. The disruption of normal brain tissue and the accumulation of blood lead to immediate neurological deficits and long-term cognitive impairment. The prognosis of hemorrhagic dementia largely depends on the location and extent of the hemorrhages, as well as the timely management of the underlying cause. Rehabilitation and support are essential components of the management plan for individuals affected by this condition. Cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy, CADASIL, is a hereditary cerebrovascular disorder. It is characterized by recurrent subcortical ischemic strokes, migraine with aura, white matter changes on neuroimaging, cognitive impairment, and mood disturbances. CADASIL is caused by mutations in the Notch3 gene, leading to abnormal deposition of granular osmophilic material in small arteries and arterioles. CADASIL typically presents in mid-adulthood and progresses gradually over time, causing significant disability. Neuroimaging findings, including white matter hyperintensities and lacunar infarcts, are essential in diagnosing CADASIL. Genetic testing can confirm the diagnosis and facilitate genetic counseling for affected individuals. White matter changes, as observed on neuroimaging studies such as MRI, encompass a broad spectrum of pathological alterations. These changes can range from subtle abnormalities, such as paraventricular hyperintensities or gliosis, to more severe conditions like leukorrhiosis. Chronic cerebral ischemia, small vessel disease, and other vascular insults are commonly associated with white matter changes. The clinical significance of white matter changes lies in their correlation with cognitive decline, neurological impairments, and functional decline. Accurate interpretation and appropriate correlation with clinical data are crucial in differentiating normal age-related changes from pathological white matter alterations. Strategic cortical infarcts refer to ischemic strokes that occur in specific cortical areas and result in characteristic clinical manifestations. These infarcts typically involve the territory of one of the major cerebral arteries supplying the cortex. The clinical symptoms depend on the affected cortical region and the neuronal networks disrupted by the infarct. For example, infarcts in the primary motor cortex can lead to contralateral hemiparesis, while those involving the language areas may cause aphasia. Understanding the vascular anatomy and the clinical consequences of strategic cortical infarcts is crucial for accurate diagnosis, prognosis, and management. Vascular cognitive impairment, VCI, refers to cognitive deficits caused by cerebrovascular disease, either as a result of large infarcts or chronic cerebral hypoperfusion. The spectrum of VCI ranges from mild cognitive impairment to vascular dementia. VCI can coexist with other neurodegenerative disorders, such as Alzheimer's disease, further complicating the clinical presentation and management. Differentiating VCI from other causes of cognitive impairment, such as primary neurodegenerative disorders, is vital for appropriate management and treatment strategies. Neuroimaging, neuropsychological testing, and careful clinical evaluation are essential in establishing a diagnosis of VCI. Neuroimaging plays a fundamental role in the diagnosis and management of cerebrovascular diseases. Various imaging modalities, including computed tomography, CT, magnetic resonance imaging, MRI, and angiography, provide valuable information regarding the location, extent, and underlying pathology of vascular lesions. CT is useful for the rapid assessment of acute intracranial hemorrhage and identifying early signs of ischemic infarcts. MRI, with its superior soft tissue contrast, is invaluable in detecting small vessel disease, white matter changes, and cortical lesions. Advanced neuroimaging techniques such as diffusion-weighted imaging, perfusion imaging, and spectroscopy provide additional insight into tissue viability, hemodynamics, and metabolic changes. Cerebral hypoperfusion refers to an inadequate blood supply to the brain due to reduced cerebral blood flow. This can result from various etiologies, including stenosis or occlusion of the major arteries, systemic hypotension, or impaired autoregulation. Chronic cerebral hypoperfusion contributes to the development and progression of several cerebrovascular diseases, including small vessel disease and multi-infarct dementia. Clinical manifestations of cerebral hypoperfusion can range from mild cognitive impairment to transient ischemic attacks or even severe strokes. Considering the underlying cause and initiating appropriate treatment are essential in preventing further neurological consequences and improving patient outcomes. In conclusion, cerebrovascular diseases encompass a wide range of conditions that affect the blood vessels in the brain. Small vessel disease, strategic infarcts, white matter hyperintensities, microbleeds, multi-infarct dementia, hemorrhagic dementia, cerebral autosomal dominant arteriopathy, and other related entities pose significant challenges for both diagnosis and management. Neuroimaging techniques, along with a thorough understanding of cerebrovascular anatomy, pathology, and clinical presentation, are essential for accurate diagnosis and appropriate management strategies. As future neurologists, your grasp of these complex topics will enable you to provide optimal care for patients with cerebrovascular diseases.